In this video, we are going to discuss regarding the antiepileptic drugs. So, in this chapter, we are going to antiepileptic drugs. So, first, I am going to classify these drugs. So, we have lots of classification. So, first group is the barbiturates. Then there is another one is deoxybarbiturate. Then there is hydantoin. Then another group is immunostilbin. Then another group is succinamide. Then another group is aliphatic carboxylic acid. Then there is benzodiazepines. These drugs are also used in the epileptic patient. Then there is three other classifications. So one is phenyltriazine. Then there is newer drugs. Then there is cyclic. One group is cyclic GABA analogs. Now we are going to discuss regarding which drug fall in the which group. So in the barbiturates there is a phenobarbitones. After that, in the deoxybarbitones there is the primidone. In the hydantoins there is two type of drugs, phenytoin, and another is the phosphenitoin. And there is like immunostilbin. In the immunostilbin there is a three drugs. One is carbamazepine. Then there is oxcarbazepine. Then the third one is carbazepine. Now moving on the succinamide, there is ethosuximide. And then when we're moving on the aliphatic carboxylic acid, in the aliphatic carboxylic acid there is two drugs. One is valproate sodium. This is valproic acid. It is also known as valproic acid. Then the another drug is devalproex. And moving on the benzodiazepines. Some drugs are included in the antiepileptics. So these are the clonazepam, then diazepam. Then there is lorazepam. Then clobazam. These are drugs fall in the benzodiazepines. After that is cyclic analogs. So in the cyclic analog there is the GABA pentin. After that there is a pregabalin. Then when we look the phenyltriazine. In the phenyltriazine there is one drug, lamotrigine. lamotrigine. And then in the newer drug there is a lots of drug in the newer drug. So here there is topiramide. Then there is levetiracetam. Then there is zonisamide. After that there is a vigabatrin. Then there is tiagabin. Then there is lacosamide. This classes of this drug are included in the newer drug. So after classification we are going to discuss regarding the drugs. So first we have discussed the based on the MOA. So when there is opening of the sodium channel, this is a cell membrane. In the cell membrane there is a sodium channel. So suppose this is a sodium channel. This is our sodium channel and it's open and closed. So when it's open, at this time there is like some drug that cause it's opened. It's make open or block this phase. So when it is blocked, so this is known as prolongation of sodium channel inactivation. When sodium channel is inactivated, so there is a hyperpolarization. So in this MOA there is some drugs like phenytoin. Then there is carbamazepine. Then there is valproate. Then there is lamotrigine. Then there is topiramate. After that there is zonisamide. And then there is lacosamide. These are drugs which cause the prolongation of sodium channel or inactivation of the sodium channel. After that, if there is some neuron which release glutamate, and that release glutamate, and there is a receptor for the glutamate. This is a receptor for glutamate. So when it releases and then inhibition of the excited glutamatergic synapse. So when it's blocked or there is no excitatory activation ongoing, so this type of inhibition is known as inhibition of excitatory glutamatergic synapse. So in this group there is phenobarbital and there is phenytoin. After that there is lamotrigine. After that there is topiramate, valproate. Then there is two drugs also. There is lacosamide. Then there is levetiracetam. These are fall in the there is inhibition of the glutamatergic synapse. And after that, if there is GABA is released, so this GABA there is like some neuron releasing GABA. So GABA is inhibitory action in the sense. So the there is a barbiturates or benzodiazepine that opening the chloride channel. So there is like the receptor of this. There is like action side part of benzodiazepines, and there is a side of the for barbiturates. So when GABA act and that open the chloride channel, so this drug also acts on chloride channel. So there is a facilitating of GABA mediated chloride channel. So there is some drug chloride channel opening, like act as the GABA. So when the GABA is inhibitory action, so this drug also open the GABA channels and the chloride channels. So that leads to the hyperpolarization of the neuron. So action is decreased. So the barbiturates, which also act on the GABA receptor. There is a benzodiazepines, BZD. There is a vigabatrin. Then there is a valproate. After that there is a gabapentin. Then is tiagabin. This drug acts like act on the GABA receptor and that facilitates the chloride channel. Now the last one is the full calcium. There is a like glial cell release calcium. So there is like this is the releasing of the calcium. So we can inhibit the calcium channel. So inhibition or there is a like this is a calcium channel, and this is this is a T-type calcium channel. So when it's inhibited, there is no action. So inhibition like there is a inhibition of T-type calcium channel or current. So there is some drugs like this drug are ethosuximide, then there is valproate, and there is zonisamide. This drug open the calcium channel, or sorry, this block the calcium channel, and when the calcium channel block, there is a no depolarization action occur. So now moving on the some drugs. So moving on the some drugs and their pictures. So first we have discussed regarding the aliphatics, carboxylic acid. So this in this group there is a valproic acid, and divalproex of drug is fall in this group. So regarding valproic acid, like valproic acid or sodium valproate, this is a broad spectrum of the anticonvulsant action, effective in the partial seizure or the generalized tonic seizure. So effective in partial seizures, or also in generalized tonic-clonic seizure, and also effective in the absence seizures. So it is a broad spectrum anticonvulsant convulsant. And regarding MOA of this drug, how it's act is frequently dependent on prolongation. It's act on the sodium channel, and prolong the action, prolong the opening, prolonged open state of the sodium channel, or inactivation of the sodium channel, inactivation. So this is a weak. This is a one MOA. So another one is like weak attenuation of the calcium mediated current. So also it acts on the calcium mediated T cell T current mediated T current. And third action is the augmentation of the release of GABA, and like it helps release of GABA by inhibiting its degradation as well as increase the synthesis of glutamic. Like when the GABA is releases, increase the GABA by the inhibiting action of the degradation and increase the synthesis of glutamic acid, and increasing the synthesis of glutamic acid. Acids. Regarding the pharmacokinetics of this drug, it is a good oral absorption. Here is the good oral absorption. It's very good. It's completely metabolized in the liver. By enzymes CYP to C9, and also 2C19 enzymes, and by the gluconic and also glucuronide conjugation. And regarding plasma T half is equal to 10 to 15 hours. And adverse event which there is increase the plasma level of when the adverse event, we look at there is anorexia, vomiting, and the loose motion, heartburn, dose related effect including the traumatinous ataxia and tremor also seen. And when we look at there is also systemic alopecia, hair fall, falling of hair, or the vitiligo are seen, and the rashes, thrombocytopenia are seen. This type of adverse effects are seen in these cases. So when we look at the interaction of this drug, in the interaction so when we discuss the interaction, it increases the plasma level of the phenobarbital and the lamotrigine, and decrease the metabolism of phenytoin. It decrease the metabolism of the phenytoin, and also it's not given along with the clomazepam and the carbazepine. These are the interaction. Increase phenobarbital and also lamotrigine. And regarding decrease the metabolism of phenytoin metabolism. And regarding it is not given with two drugs like clonazepam. Then there is carbamazepam, carbamazepine. This is not given with this drug. Now moving on the another group of drug. This is known as benzodiazepines. Regarding benzodiazepine, the drugs fall in this group are the clonazepam, then diazepam, then there is lorazepam, then there is clobazam. These are drugs. So moving on the clonazepam. So clonazepam is a prominent anticonvulsant properties. When we look at the MI of this drug like importance to the GABA induce chloride influx. It's potentiate GABA induce chloride influx, like it increase the chloride in the like inside the cell, or open the chloride channel in the open state by acting on the GABA channel. Moving on the diazepam. Also, like it's a pharmacokinetic. First discuss regarding the pharmacokinetics of this drug, and it is a oral good absorbed, and there is like this is completely metabolizing the liver, completely, and it's like plasma half life will it is 24 hours. T half is what 24 hours. These are some pharmacokinetics. After that, there is adverse effects. So the adverse effect of this drug, ADR of this drug. There is in ADR there is a sedation, then dullness. There is a lack of concentration, irritability, and dose related effect are the motor disturbance and ataxia. Like there is a dose related effect are motor and disturbance and ataxia occur. After that, we need to the uses of this drug. So it is used in the absence seizure, seizures. Then there is like it's also adjuvant as the myoclonic and akinetic myoclonic and akinetic epilepsy, and to the suppose it suppress acute mania. These are the use of the clonazepam. Now moving on the clobazam. This drug clobazam is orally bioavailable, is 90% oral, and when you look at the elimination life, like T half is 18 hours, and active metabolite has like more than 34 hours. Active metabolites T half is 35 hours, more than 35 hours, and this is generally used as the adjuvant. Moving on the diazepam, it's used as adjuvant. Now we are moving on the diazepam and lorazepam. So regarding the lorazepam is lesser. It has lesser phlebitic complication, and there is more sustained action than diazepam. It has more sustained action as diazepam. Now moving on to diazepam. Regarding diazepam, it is a first line drug of emergency condition. First line drug for emergency control of convulsions, and it is not used for the long-term therapy. And when you look at the adverse effect of this drug, ADR, adverse effect. So diazepam have adverse effects like thrombophlebitis, injection when given with IV, and it's marked for it has adverse effects marked fall in BP. Then there is respiratory depression as an adverse effect. This we can discuss regarding the benzodiazepines. Now we are moving on to another class of the drug. So in another class of this is the phenyltriazine. So phenyltriazine includes the lamotrigine, and lamotrigine is a broad spectrum of the antiepileptic, and carbamazepine-like action is shows the carbamazepine-like action. So when we look at the MO, it's prolong the sodium channel inactivation and the suppression of the high frequency firing, blockade of the voltage sensitive sodium channel, as same as the clomazepam, how this occur. And there is a pharmacokinetics. When you look at the pharmacokinetics, it is well absorbed orally, and half life is 24 hours. When we discuss regarding the pharmacokinetics, when we discuss regarding the adverse effects, so sleepiness, dizziness, diplopia, ataxia, and vomiting, rashes, which and these are the adverse effects, and the rashes which require to the drug. When we leave the taking the drug, there is a rashes seen. This is all about the lamotrigine.